Cornwall. I'm a nurse practitioner student for head to toe assessment 60/20. I've got Patrice here. She is going to be my patient. We've already spoken outside. She is awake, alert, and oriented to ×4, and she was able to answer my questions and agree to this exam. So neurologically, she is intact, and then we're going to go ahead and start the exam now. First, I'm going to inspect. Patient is well groomed, clean appearance, no lesions, no obvious scarring, anything from appearance here. Her skin she is warm, dry, and normal for her ethnicity. We're going to go ahead and move on to her head. We're going to go ahead and palpate her scalp and her skull. It is symmetrical, no deformities. Hair is evenly distributed. Okay, so then we're going to move on to her temporal arteries. We're going to just palpate those. Normal rate and rhythm. Then from there, we're going to go ahead and palpate her maxillary and frontal sinuses. Patrice, just let me know if you have any pain or tenderness in here.
Okay.
No pain?
No pain.
All right. So no tenderness or pain noted there. From there, we're going to go ahead and move on to assessing cranial nerve number 5, the trigeminal muscle. So what I want you to do, Patrice, is clench your jaw for me. All right. If you can open your jaw. All right. Good. And no pain or issues with opening or closing your jaw?
No.
All right. That means that her masseter muscle and nerve is intact, and she has no difficulty moving her jaw. Then we're going to move on to cranial nerve number 7, which is the facial nerve. What I want you to do is close your eyes real tight. And you can open them, raise your eyebrows, okay, and then puff out your cheeks. Perfect. Appears that cranial nerve 7 is intact from visual. Then we're going to go ahead and test her sensory nerves. What I want you to do is close your eyes for me. Tell me if this is sharp or dull.
Sharp.
And then sharp or dull.
Dull.
Okay. And sharp or dull.
Dull.
And sharp or dull.
Sharp.
Okay. And it looks like her accessory nerves are intact. She was able to differentiate between dull and sharp from here. Before we came in the room, we did a Snellen visual chart, which she scored a 20/20, meaning vision is intact without any contacts or glasses. From there, we're going to go ahead and assess her peripheral vision. I want you to tell me when you can see my fingers wiggling, okay?
Okay. I can see it.
Okay, so peripheral vision is intact. From here, we're going to go ahead and assess cranial nerves 3 by checking her ocular nerves. All right, you can just look straight ahead. Okay. She has good pupillary response. Pupils are about 3 to 4 millimeters in size, reactive to light and accommodation. And then sclera is appropriate also for ethnicity. No whiteness or paleness or discharge noted. We're going to go ahead and assess the 6 cardinal fields of vision, which will be cranial nerves 3, 4, and 6. So what I want you to do is just stay there at my nose, and then I want you to follow my finger, okay? All right, great. So it looks like the visual acuity is great, and that she does not have any difficulty with her ocular nerves 3, 4, or 6, and no nystagmus was noted also during that time. We're going to go ahead and move on to her ear, which we'll go ahead and look at her outer ear first, just to make sure that the structure is intact. You can look that way for me. Okay. Looks like the actual auricle is intact and clean. We're going to look inside. Okay. I don't notate cerumen buildup. It is moist and clear. The tympanic membrane is visible. From this, we're going to go ahead and assess cranial nerve 8, which is the acoustic cranial nerve, I'm gonna step 5 feet back and whisper 3 words to her. You ready, Patrice? You just tell me when you hear them, okay?
Dog. Mom. Dad.
Okay, so the patient is able to hear all the words that I was able to say, and that means that her hearing is intact at this time. We're gonna go ahead and at this point, I would assess the patient's, the Rhine test and the Weber test, which would actually check for the patient's lateralization of sound as well as air and bone conduction. From here on, we're gonna move to the nose. We're gonna take a look at the outside. It is symmetrical. I don't see any lesions present. We're gonna go ahead and check for patency. I'm gonna put this finger here, and I want you to sniff. Okay, and then the other side. All right, great. Both nares are patent. We're gonna look at the inside internal structure of her nose. Can you look up for me? Okay. Looks good. No discharge, no erythema noted. And then she also, I'm able to visualize the nasal terminates. From here, we're going to go ahead and inspect her mouth. You can go ahead, looks like from the external features, lips are symmetrical, mouth is symmetrical. Smile for me. All right, good dentation noted. We're going to take a look on the inside now. I'm going to get you to stick your tongue out for me. Okay. Great. I don't see any pore dentation, any note of cavities, lesions, abscesses, anything of that sort. I want you to say ah, ah. Okay, pharynx, the posterior pharynx is visible. No erythema, exudate, or drainage noted. Her uvula is midline, meaning that cranial nerve 9 is intact, and patient is also able to swallow. If you'll go ahead and swallow for me. And no difficulty swallowing?
No.
Perfect. So cranial nerve 9 is intact. From there, we're going to move on to the tongue, which is the hypoglossal cranial nerve. If you can stick your tongue out. Great. And we saw that earlier. It looks symmetrical and midline as well. Okay, from there, we're going to go on to the neck. I'm going to feel her neck. Feel supple. No pain or tenderness in here.
No.
Okay. And then we're going to go ahead and palpate your cervical, posterior, auricle, preauricle, and tonsillar lymph nodes, as well as some submandibular and submental lymph nodes and subclavicular. Any pain or tenderness where I'm pushing?
No.
No? Okay, great. We're going to go ahead and assess her thyroid. Okay, so I want you to swallow for me. Great. The thyroid is palpable. I don't notate any nodules, pain, or swelling with this, so it is looking good. From there, we're going to go ahead and move on to the shoulders and clavicle. All right, so I'm just going to palpate here. Any pain when I push?
No.
No? All right, and no pain back here in your neck or your shoulders or clavicle?
No.
No. Okay. I am going to go ahead and check cranial nerve 11. So I want you to, I'm going to put some resistance on your shoulders. I want you to shrug for me. Great. So that is intact. She is able to move against resistance for me. From there, we're going to talk about the elbows. So I want you to hand me your arm. I want you to do a little bit of range of motion. Exercises here. All right. No pain, any tenderness with that.
No.
And same with this one. Okay. Great. I'm going to go ahead and palpate the radial pulses, or the brachial pulses and the radial pulses. Regular rate and rhythm detected, no abnormalities. Okay. Next thing we're going to do is check the range of motion of your shoulders. So I want you to hold your arms up for me and back down, and then out to the side. Sorry, and then up and down. Patient has great range of motion with flexion, extension, adduction, and also pronation, supination. From here, we're going to go ahead and do some, let's see. Oh, we did test, I'm going to go ahead and test for your strength in your upper extremities. If you can hold on to my hands, I want you to pull against me and push Patient has 5 out of 5 strength, no issues with any range of motion, and strength is a very easily to come by thing in Patrice. So now we're gonna go ahead and auscultate real quick. We're gonna do some, we're gonna go ahead and auscultate for her carotid arteries. First, we're gonna palpate them. Okay. One at a time. Okay. Regular rate and rhythm detected. Now we're gonna auscultate. No bruits detected, no thrills. The rate is also regular and no abnormalities noted. We're going to move on and check her anterior chest and listen to her lung fields. We're going to go ahead and listen to your lung fields. If you'll take a deep breath in for me and out. Good, and again. And then one more time. One more time. Okay. Patient has clear lung sounds bilaterally. Their bronchovesicular and vesicular lung sounds were heard. I'm going to go ahead and listen to her heart sounds, starting with aortic, move on to pulmonic, then tricuspid, and then mitral valve. And at the fifth intercostal space is the point of maximal portion, PMI. Okay, great. All right, so we are going to go ahead and check her back of her posterior chest. Okay. I'm going to check for any CDA tenderness, percussion. Let me know if you have any pain here.
No.
Any pain here?
Nope.
All right. We're going to go ahead and listen to her lung sounds posteriorly. Okay. Deep breath in and out. In and out. In and out. In and out. Lung sounds are clear, no adventitious sounds noted, no wheezing, rails, or crackles on auscultation. We're going to go ahead and also check for, we're going to go ahead and lay Patrice down at this point. If you'll go ahead and lay back for me, I'm going to lay you kind of flat. Okay. All right. We're going to go ahead and inspect her abdomen at this point. I'm just going to put your, is that okay? Okay. Okay. I don't notate any hernias, striae, lesions, abscesses, or excessive scarring. Okay, we're going to go ahead and listen to her vowel sounds in all 4 quadrants. Okay, good. Vowel sounds noted in all 4 quadrants. Next, I'm going to go ahead and auscultate her arteries, including the abdominal aorta, the renal arteries, and the femoral arteries. And no pulsations noted on inspection in the abdominal aorta. artery sounds, no brewery thrills noted, regular rate and rhythm during that. We're gonna go ahead and start out with some palpation. All right, we're gonna start out with light palpation first and then move on to deep. Okay, I'm gonna go ahead and push on your stomach. You tell me if you feel any pain with me pushing.
Okay.
Any pain here?
No.
Any pain here?
No.
And here?
No.
Okay. I'm gonna go ahead and assess for her liver borders at this point. Okay. Any pain there?
No.
All right, during percussion, all sounds are resonant, no dull or tympanic or drum-like sounds noted. And then over the liver, I did not notate any border irregularities, appears to be within normal limits there. We're gonna go ahead and palpate her spleen, as well as percuss. Okay, no pain there. And then palpate this, and percusses. All right. Percussion sounds within normal limits, resonance noted, and no hepatomegaly noted on exam. From here, we're gonna go ahead and check the psoas sign and the obturator sign. What I'm gonna do, Patrice, is lift this leg, okay? And you tell me if you feel any pain in this right lower quadrant, okay?
Okay.
Any pain?
No.
Great. Negative psoas sign. And then I'm gonna get you to just relax this leg for me. We're gonna turn it inward. Any pain like that?
No.
We're gonna turn it this way as well. Any pain like that?
No.
That's a negative obturator sign as well. She has no rebound tenderness on palpation. And then we're gonna go ahead and check for her pelvis stability. You're gonna feel me pushing here. Any pain?
No.
All right. Pelvis is stable. No ecchymosis noted. No edema present at this time. Appears stable. If you can lift your hips for me. Good. And then move them side to side. Great. Patient has good range of motion with flexion and extension and laterality movement. From there, we're going to go ahead and check for her lower extremities. Well, we also need to check the anterior surfaces of her hips. Okay, no pain. Okay. All right, from here, we're going to go ahead and do the knee exam. I'm going to, excuse me, bend your leg for me. Good. Any pain or tenderness?
No.
Patient has good range of motion there. And again, with this one, patient has good range of motion there. All right. We're going to go ahead and move on to, and also I'm going to feel the patella. No pain there.
No.
And here?
No.
No crepitus noted. Patella is palpable, no swelling or edema present. From here, we're going to go ahead and feel her femoral arteries. Okay, her popliteal. And then dorsalis pedis. And posttibial. All are good, even, and regular and palpable at this time. Okay. Put this down. Okay. All right. And then she also had full range of motion with her ACL ligament during movement with her lower extremities. And then we're going to go ahead and look at her feet. No edema noted. No swelling at all. We're going to go ahead and check for flexion and extension. Okay, if you can push against me. And then pull back. Great. Patient has no issues with range of motion in her feet. Excuse me. All right, we're going to do one last thing here. We're going to check for her sensation in her legs. Tell me if you feel dull or sharp.
Sharp.
Okay. And then dull or sharp.
Sharp.
Okay. Is it dull or sharp?
Sharp.
Okay, great. All right. Okay. So from here, we're going to go ahead and check her deep tendon reflexes. I'm going to scoot this back. I'm going to sit you up.
Okay.
All right. If you want to sit in the side of the bed again for me. All right. We're going to go ahead and check for her bicep deep tendon reflex first. What I want you to do is just relax your arm.
Mm-hmm.
Okay. Okay. You feel a little hit, and then I just want you to just relax his arm.
Okay.
Okay. Patient has good bicep, deep tendon reflexes. We're going to go on to the brachioradialis. Okay. Good brisk reactions there. We're going to go ahead to the tricep. I just want you to relax your arm. Perfect. Just relax it completely. Okay. Great movement there. Last patellar. Ooh, good one there. And then plantar. You can't see me down here, but we're checking for plantar, which she has good brisk movement there. Okay. A couple of last things we're going to do is I want you to close your eyes for me. We're going to test for stereogenesis. I want you to identify this object that's in your hand. Paperclip. Yeah. And then we're going to put another object in this hand. I want you to tell me what it is.
Battery.
Yeah, that is exactly right. So then we're going to go ahead and check for graphicthesis. I want you to keep your eyes closed again. I want you to tell me if you feel one or two sharp objects.
One,
And then one or two sharp objects.
two.
Okay, patient has good sensory notation with that. She's able to detect the objects and tell the differentiation between the two. We're going to go ahead and do a little bit of upper extremity coordination. I want you to touch my finger with your finger and then touch your nose. And again. And then the other finger. Okay, great. And then we're going to test her lower extremities. So I want you to put your legs back and forth, just wiggling back and forth with rapid movements. Okay, patient has great coordination there. I'm going to go ahead and let your bed down some. I want you to stand for me. Okay, and then I want to make sure that you have good spinal range of motion. I'd like you to reach down and touch your toes as far as you can. Back up. And then spin side to side. Great. Patient has good range of motion with her spine. Couple last things is I want you to heel to toe walk towards me. Okay, great. And then we can come back. Can you see? All right. Patient has steady gait, no swaying or movement noted. We're going to do a Romberg test in which I want Patrice to close your eyes and just stand there. Okay, great. I don't notate any swaying or movement during this time. That is a negative Romberg test, so she passed. And then the last thing we're going to do is check for any drift in her arms. So I want you to put your arms out in front of you. Perfect. And then just hold them and close your eyes for me. Okay, great. That is all we need. She did not have any drift during that exam, so that means she has great strength in her upper extremities. That concludes our head-to-toe assessment on Patrice for nursing 6020.